So this is my week 4 Strattera update. Tomorrow will officially be 1 month of me taking 60 milligrams of Strattera for inattentive ADHD, and I think it does have an off-label use of also treating anxiety, although I have not noticed any improvement in my anxiety since I've started taking it. But I did mention in my previous video that I was finally starting to see some improvements in my focus. So I do think that it's doing its job as far as treating the inattentive ADHD. But I met with my provider last week and I explained to her the symptoms and side effects that I'd been experiencing with Strattera, which I have gone into detail about in previous videos. Dry mouth, slight nausea after taking the medication, and lack of appetite, but nothing too bad. And so she asked me if I wanted to increase the dose. I told her that I was okay with staying on 60 milligrams for now, but that I hadn't seen any improvement in my anxiety. And she asked me if anxiety was something that I always experienced or if it was something that just comes and goes depending on the situation. And the fact is that I'm always anxious no matter what I'm doing. I'm always experiencing some degree of anxiety. I'm anxious right now and I'm home alone in my office. This is probably my comfort zone and where I feel the safest. It's where I'm used to being most of the time. And I still feel some level of anxiety, even now. And of course, it does peak and it gets worse when I'm out in social situations and just depending on what it is, but I'm always anxious. And she looked through my record and she noted that I had taken Zoloft in the past, which is probably what most providers will prescribe you. That's probably the first medication that they will give you if you tell them that you're experiencing depression or anxiety, of which I have both because I also have a major depressive disorder. And I did take Zoloft, I believe, back in 2019, and I have posted 2 videos about that, about how I was on it for 8 months, and it does a great job at helping with the anxiety and with the depression, and but it did make me gain a lot of weight in those 8 months that I was taking it. And I know a lot of people will say, well, I'd rather be 400 pounds than be anxious and depressed. And do remember that I have cerebral palsy, so I already struggle getting around physically. And with the almost 40 pounds that I gained on Zoloft, I got a lot more fatigued and it became a lot more difficult for me to move around. So it was a deal breaker for me. I had to stop taking it. If it wasn't for the weight gain, I think I definitely would have stayed on Zoloft for the treatment of anxiety and depression. So when I talked to my provider about that, she said she was going to place me on a new medication called Trintellix. It's fairly new. It was approved by the FDA back in 2013. Its main use is for the treatment of major depressive disorder, but I'm assuming that it also does something to treat the anxiety, or else I don't think that she would put me on it, because I did tell her that I wanted to focus on treating the anxiety. It is an SSRI, which is the same type of medication that Zoloft is. So I'm assuming that it does treat anxiety as well as depression. And she said that it doesn't have as many side effects as Zoloft does, but it is fairly new, so there haven't been that many studies done really as far as the side effects go. But based on some research that I did read that nausea is one of the main side effects that people tend to experience, which really sucks, because if you've been following my videos, you know that a couple of about two months ago, I was placed on a mood stabilizer, and it gave me really bad nausea, and I was throwing up, puking my guts out every single night for about 3 weeks, till I just had to stop taking it. I thought that the nausea and the vomiting, I thought that it would all subside after a while, but I just couldn't keep taking it because it was really bad. And when I was placed on Wellbutrin, I got a rash. And when I was placed on Zoloft, I got like excessive weight gain, which is like the milder, less severe side effects that of all the side effects that I've experienced so far with all the different medications that I've tried, which have been quite a few, and I've reviewed and talked about them in my channel. Most of them have not worked out for me. My body seems to have a sensitivity to medication. So Strattera so far, I haven't experienced too many side effects, just the mild nausea, the dry mouth, and the lack of appetite. But it's nothing that I can deal with, that I can't deal with, and it's nothing that is too extreme. So I'm going to stay on the 60 milligrams of Strattera for now to mitigate the effects of the inattentive ADHD. And tomorrow I'm going to start on the 10 milligrams of Trintellix, which will hopefully help me with my anxiety and help me kind of um, I don't know, not feel as anxious, I guess. So I guess technically, as of tomorrow, I will be on two medications at once. And once I'm taking Trintellix, once I've taken it for about a week, I'll come back here and do a review on that. My provider did say that I could take them both at the same time if I wanted to. I could take them both in the morning. I hope that they don't. Uh, I hope that they don't give me like bad side effects because I'm taking them together. But I know that there are plenty of people that take several medications at once, and they do just fine. It's just the fact that, like I said, my body seems to be sensitive to medication. So I don't know how it will react when I add the Trintellix on top of the Strattera. I'm just hoping that it won't be too bad. But I'm excited to finally get back on something that will help me feel less anxious, because if you have social or generalized anxiety like I do, you know what it's like to be anxious all the time, no matter what. And I have tried. I've been going to cognitive behavioral therapy for like almost 2 years now, and I'm not going to say that it doesn't help. It does help. But even when I try deep breathing exercises and meditation and all this other stuff, it's like no matter what, I'm still always anxious. And it's sometimes, most of the time, there's no particular reason, because my therapist will often be like, well, what are the thoughts associated with your anxiety? And the fact of the matter is that most of the time I'm not thinking anything. I just feel really anxious. I can feel the anxiety. I just get nervous and tense out of nowhere, and I don't know why, and I can't control it, and I just can't seem to be able to deal with this very well on my own. I mean, I've lived with anxiety for my entire life, and yes, I have dealt with it without a medication, and I have survived, and I have lived with it since for as long as I can remember. But it's a miserable way to live, and it sucks, and I don't like it, and I just don't want to keep living that way anymore. Um, I want to experience what it's like to live life not feeling anxious every second of every day, and being okay to go to social situations without feeling like I'm making a fool of myself, and being okay with making eye contact, and being okay with recording videos of myself on Instagram and posting it, and not thinking about how awkward or weird I look when I talk, or like, it's just sometimes there are thoughts associated with my anxiety, and most of them are negative thoughts. But a lot of the times, there are no thoughts associated with me feeling anxious. I just sometimes start feeling anxious out of nowhere for no particular reason at all. And some days it's worse than other days. And so I really think that it's time to get back on something that will help me cope with that. And I'm going to continue to go to therapy, and I'm going to continue to try practicing meditation and deep breathing. But if this medication is going to help me feel more relaxed and calm throughout the day, um, then that's great. just whatever is going to help me feel okay, that's what I'm going to do. And so, yeah, I guess I'll be back in about a week when I give Trintellix some time. And I'll probably be doing weekly updates on that medication as well as Strattera. So, yeah.